why do we need to do health screening? It's to detect, as I told you earlier, it's to detect diseases before it becomes a disease. So that's why we need to do health screening, because prevention is still better than cure. And the importance of health screening is to first to prevent diseases before symptoms even develop. We will detect abnormalities, and if we can detect abnormalities at that time, we are able to detect it. We are able to give the necessary intervention and earlier treatment as to prevent diseases. Right. Of course, if you can do that, you can save life. And to help to lead a healthier lifestyle, of course, if you don't have disease, we can lead a very healthy lifestyle. And to detect disease early and treat to prevent complications. When we talk about prevention, talk about primary, secondary, and tertiary prevention. Right, primary preventions would include all this: immunization, lifestyle changes, losing weight, diet. While secondary preventions is to identify and treat asymptomatic patients with risk factor or preclinical disease. Preclinical disease means that before the disease develops, we are able to detect it, and this is where health screening comes. And some of the health screening includes pap smear, blood pressure screening. Tertiary prevention is you already developed a disease, and now we need to prevent complications. We need to monitor the disease, like for example, diabetes mellitus. We need to monitor the blood sugar level, and high blood pressure. We need to monitor the blood pressure, cholesterol, and sugar level as well, and the kidney function to prevent complications. So health screening comes under secondary prevention. Okay. Primary prevention prevent the development of the disease. Immunization, lifestyle changes, losing weight. Well, this is health screening, where health screening comes in. And a few of the health screening tests that we do, which is very common and also important, is pap smear, blood pressure screening, lipid screening, blood sugar level, cancer screening, bone mineral density to detect, to check your bone strength to detect whether there is any osteoporosis. Can health screening screen all diseases? Unfortunately, no. It screens common diseases and where treatment are available. Okay. So, the importance why you should progress to do health screening. Why? Because we must look at the leading causes of death in, let's look at the United States first. For instance, in 2002, the leading cause of death is still heart disease. So constitute about 600, almost 700,000, followed by cancer, malignant neoplasm, and cerebrovascular disease, which is stroke, and lung diseases, pneumonia, then only followed by accidents, diabetes, influenza, pneumonia, and Alzheimer's diseases. Kidney problem, septicemia is infection, suicide, and liver disease, hypertension, kidney disease, pneumonia, and homicide. Now, in Malaysia, what is the top 10 diseases in Malaysia? According to our MOH hospital, the first one is septicemia, which is the infection. Second one, followed by heart diseases, and followed by cancer, and stroke, accident, pneumonia, and diseases of the digestive system, kidney disease. Well, when we look at cancer, what is the top 10 cancer in Malaysia? The first one is still lung cancer. Second would be colon cancer, followed by breast cancer, stomach cancer, prostate, bladder, oral cancer, skin cancer, and cancer of the uterus, followed by ovarian cancer. Cancer to be the world top killer by 2010. Okay? WHO says. Well, this is the 10 most frequent cancers in male. The first, number one is still lung cancer, followed by the nasopharyngeal cancer, which is the ear, nose, throat cancer, colon cancer, then leukemias, cancer of the blood, colorectal cancer, prostate cancer, stomach cancer, lymphoma, other skin disease, and liver disease. I'm sure everyone has heard of all these cancer before. And female, of course, is still the female organs, breast, cervix, colon. Is there any prevention? Yes, there is prevention. But how? First of all, is still healthy lifestyle and diet modification. Well, this is the healthy diet. Reduce the incidence of heart disease and cancer, it is proven. And the Mediterranean diet actually reduces the risk of coronary events 70% compared to Western diet. You know, the Mediterranean diet, what is this? This is olive oil actually. One of the, what consists of the Mediterranean diet is a low in saturated fats and no trans fatty acid and contain very little red meat. This diet contains monounsaturated oils like olive oil, whole grains, fresh fruit, vegetables, omega-3, no smoking, and regular exercise. This is childhood obesity. This is not good, and caused by all this diet. This is a food pyramid showing what food to take in moderation and what food to take in a bigger amount. Okay, this is health screening, whereby this is where blood sampling takes place, and prevention is through. Well, if we talk about, I will go through a list of health screening tests with you all. The following tests is by no means comprehensive. Some of the tests are not included because they do not meet the criteria for effective preventive intervention.